Thank you, Adrian. So the treat and extend for PCV, these are my financial disclosures. I will start with a brief introduction, then I'll move on to the experience we have, or the data we have in Asian population. Then I will talk about the results we have in Asian and Caucasian population mixed studies. And finally, I will talk about the Atlantic study, the experience we have, or the data we have coming from the Atlantic study in Caucasian populations. So why we treat these patients? Because they are losing vision. They lose vision because they have polyps, but they also have the branch vascular network, and both can exudate. They also lose vision because of the hemorrhages. We have different drugs, as Vastada has shown. We have different treatment regimens, and we have probably a combination therapy. And Adrian will talk also about with PDT. And the primary goal of PCV is to achieve the best visual acuity outcome and minimize treatment burden, of course, to dry the retina. So what data do we have? We have data from treat and extend. I'm going to talk about treat and extend regimen in Asian population. Most of the information we have is from Asian population. And this is a subgroup analysis from patients coming from the Altair study. 1/3 of these patients were PCV patients, and they gained more than 7 letters at 1 year, and more than half of these patients achieve a retreatment interval of 12 weeks or more. So this is a subgroup analysis. Vasada mentioned already the Hawk study. So what I want to say to you is that this is a subgroup analysis again. The mean change of visual acuity was superior to 10 letters at 2 years with brolucizumab, and more than 2/3 of these patients were kept in 12 weeks or more immediately after the loading dose, and they remained with this interval. However, there was a higher incidence of intraocular inflammation, 15%. But I must emphasize that only one patient lost vision, and this patient lost 4 letters. What about the mixed population, Caucasian and Asian population? The Planet study has shown in the second year, you remember the second year the patients were treated in treat and extend, and the interval could be increased. It depends on the decision was the investigator, 1 week or 2 weeks. And in the second year, these patients, they performed only 4.6 injections, and they gained 12.3 letters at week 96. So this is information we have from Asian population or mixed population. So now I'm going to show you the information we have in Caucasian population. This is a randomized, double-masked, sham-controlled phase 4 study comparing aflibercept in treat and extend plus PDT with patients receiving a sham PDT and all being treated with aflibercept in a treat and extend regimen. Angela and Emmanuel, they showed you that the population is different. So when we are talking about Caucasian population, these patients, they have more macular drusen, they have less hemorrhages, they have smaller lesions. And this is important, it has impact on the results. So this is a typical lesion, Caucasian lesion, as you see, one polyp, the BVN, and some exudation, but which is quite different from the Asian lesions we are used to see. So one point I'd like to emphasize, after the loading dose, more than half of the polyps became inactive. So 8 weeks after 3 injections. This is important. And we had a complete polyps occlusion in 1/3 of the cases with the loading dose. Of course, we have fluid in 2/3 of the patients because BVN is the branch vascular network is also exudating. So these patients, the vision improved. Only 11 patients, or 22% of the patients, were treated with PDT and only 1 treatment. So these are the frequent questions related with the treat and extend. How many injections? Usually we perform 3 injections. So you have level 1 scientific evidence for this. When to consider the monotherapy in treat and extend, if we have macular fluid, if we have an active or inactive lesion, and of course, if this lesion, the visual acuity loss is due to this lesions. When to start a treat and extend monotherapy? The discussion is 4 weeks after the third injection, or 4 weeks or 8 weeks. We usually start 8 weeks, we hit 2 months. And how to schedule the extension follow-up. So decrease or increase, we are doing, and I'm talking about Caucasian population with interval of 2 or even 4 weeks. In the presence or following or guided by the presence or absence of fluid. So to conclude, we have scientific evidence level 1 to support the treat and extend monotherapy with aflibercept up to 2 years in Asian and Caucasian population, with significant visual acuity improvement, with burden reduction and no safety concerns. As you remember, brolucizumab showed high efficacy, but we all know are concerned about inflammation. In spite of only one patient having lost vision during the treatment, and PDT added no benefit in PCV Caucasian populations being treated with aflibercept in treat and extend up to 1 year. And thank you for your attention. And now I call Adrian.